There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what should I do to tackle a sudden increase in blood pressure to prevent a heart attack? Answer by Neelu Maini. If you are already on medication for hypertension, you may take the medicine at the earliest, as prescribed by your doctor. Wait for a while and recheck your blood pressure to see if the medicine has worked for you. If the condition still persists, please visit your nearest doctor or the hospital to seek their advice. Do not wait until next day or wait to show to the doctor under whose treatment you might be, but he/she is not available at that particular moment. As emphasized earlier also, time is of essence for better outcome. Doctor takes into account several factors in order to decide further course of action in treating you. In case of sudden or acute increase in blood pressure accompanied by end organ damage, cardiovascular, renal or central nervous system, as would be clear by signs and symptoms being experienced by you, often termed as hypertensive crisis or emergency, the management protocol is different than in sudden or acute increase in blood pressure without end organ damage, termed as hypertensive urgency. Absolute increase in blood pressure is not the only deciding factor, but also the accompanying signs and symptoms indicating the presence of end organ damage resulting in right diagnosis, evaluating the cause and formulating the management plan. The most crucial factor that reduces the morbidity and mortality under such condition is prompt and carefully considered therapy. Doctors are well acquainted with the required knowledge of the condition and its effective management. Rapid lowering of increased blood pressure is not always warranted. In fact, it may have adverse effects. However, hypertensive emergency or crisis, with target end organ damage, may require immediate reduction in elevated blood pressure to prevent or stop the progression of damage of the target organ. I hope it helped. Answer by Firdosh Sholapurwala. Avoid situations where there is a sudden increase in blood pressure is the logical answer. However, if you are a healtha young person, then you should not be too afraid of an increase in blood pressure. The mechanism is such that an increase in blood pressure is required to perform certain tasks, e.g., climbing a flight of steps, taking part in a running or cycling race, or even running to catch a bus or a train. Hence, increase in blood pressure need not cause a heart attack, otherwise all adventure sports/trekking/mountain climbing would come to a halt. Actually, this sudden increase in blood pressure gives a thrilling sensation, and most joy rides in amusement parks jack up the pressure to insane heights, and rarely anybody has a heart attack. Answer by Puneet Changna. Sudden rise in blood pressure could be activation through stimulus that can be sourced back to renal insufficiency or enzyme secretion. Wait for 5 minutes and take another reading. If it comes down diastolic, you may not rush in emergencies. Later, or if not under control, visit a doctor. Calm down and have a pill for BP under advice shall help you.